Hello.
Hi.
Hello, everybody, and welcome to our SOPHIA Work Package 8 Core Research Team hangout during ECO, European Congress on Obesity. So I'm Jacqueline Bowman, and I'm the Work Package co-lead representing Third Eye. And my colleagues, Diederik and Lucas, can you briefly introduce yourselves before we get into it?
Start.
So, hi all, I'm Lucas. I'm a PhD student from the University of Brussels, and I'm currently in my third year of my PhD doing research on obesity, awareness, and the patient care pathway. And this all under supervision of my promoter, Diederik.
Thank you, Lucas. Of course, I know both of you, but for people who don't know me, I'm a professor of epidemiology at the VUB doing research in multiple chronic diseases such as obesity.
Yeah, wonderful. Okay, so the big question I think that's been on everybody's mind related to SOPHIA is, what do those people actually do in Work Package 8? Which is, for those who've not been following, what does Work Package 8 mean? It's about shared value analysis. So breaking it down concretely, what did you think that you were signing up to being on Work Package 8 as hardcore researchers, and how has that progressed? How's that evolved in terms of the reality? So let's start with you, Diederik.
Well, I think it's a great question because from an academic point of view, I had the very old-fashioned feeling we're going to do really hardcore cost effectiveness analysis, like all the numbers and all the number crunching. But then we came into the conversation, and then it was clear that that's not what shared value was in Work Package 8. What we really want to do there was to translate the findings from the rest of the SOPHIA consortium to something tangible to the outer world. So we had to step outside our academic shell, I would say, and then try to find ways how we really could communicate our findings. And I think in the end, we really came nicely through with a few messages we could really send out to the general public.
Yeah.
But yeah, of course, we were lucky with having you, of course, Jacqueline, because we are from the academic point of view, but you had a very much helicopter view as both a person with experience in policy, but also academic, but also, of course, being someone with lived experience in obesity. So I think in that sense, the shared value was something really important for you. I don't know if you really also could really put your soul into the project in a way of saying?
Yeah, absolutely. I think you hit the nail on the head, because one of the toughest parts, I think, for me, because, this has been a 5-year journey. And one of the toughest parts was actually indeed taking that meta position, taking that helicopter view, because of being so personally invested with so many different stakeholder profiles. So it was kind of an advantage as well as a challenge all the way through. But I think that coming through for me, having signed up as an SME, so not a conventional researcher, but in effect having a background of being a bridge between the science and impact for innovation, at times I thought I was almost Medusa in terms of indeed understanding and working with academics to make sure that when we asked about needs and challenges a few years ago to the various stakeholder groups, when we asked about those needs and challenges, to be able to implement obesity using a shared value and a value-based healthcare approach, to actually not just listen to them, but hear them, and then work again in order to bring that to the next phase, so that indeed we could actually bridge between what are our research findings and making real-world impact. So, and I'm about to come on to you as well, Lucas, because obviously within our work package, we started off way back when with a task force internally. We've asked lots of questions. The basic question from policymakers and regulators and payers and everybody else was, okay, what's your story? What's your narrative? Because if we don't understand what the umbrella narrative is, we can't do our jobs in order to facilitate a health system that allows you to actually have precision medicine. So when you came into the picture, Lucas, as a bright-eyed PhD student, what did you make of it all, and what has been for you, I would say, the most hard-won achievement in all of the work that you've been doing? Because you've worked a lot on getting us to the narrative, on getting us to the blueprint for change.
Mm-hmm.
What's been the most hard?
For me, it was really nice to, of course, work with so many different other countries and so many different levels of expertise and experience. For me, as a young researcher, that was a really big advantage to work with different countries, with different universities, but not only with academic people, but also from other industries.
Yeah.
That was for me one of the big advantages of this whole project and working in the IMI SOPHIA consortium. Secondly, it was also very interesting, especially in work package 8, that we could learn and had the task and the mission to translate all the different work that has been done in the different work packages and translate it to the broader community, to really summarize the main findings and extrapolate this to the wider field. And especially for me as a new researcher, that was something really interesting to do.
Well, and I think if we collectively had to say, if we had to give a message to other people with our stakeholder profile, so for me, people coming in who were bridges or who were having to think about, how does this work in reality and work with academia, what would your advice be? Because moving forward, we have the blueprint for change. It's a blueprint, which means it's on paper. But what would your advice be to others coming in who now have to go that next stage of making our narrative for change a reality, to have it embedded, of making the blueprint for change, which in effect is an index which can lead to benchmarking, to look at, from a shared value perspective, readiness to act at a systems level? What would your advice to them be? Diederik?
I think that's a very complex and challenging question, because it's knowing the problem is one thing, but changing a system behind it is, of course, very difficult. I think that's also why we set forward that the blueprint for change would be like a document which we also can measure all the different findings from different places and see where all the gaps in knowledge are. And then and if you have come back to your question about the stakeholders, which are actually not from academia, I think key is then to communicate and always being the bridge, but also being very clear about what you want to do. Because the blueprint for change is a very specific document, and I think it can also be very attacking for some people, because you want to change a system which is in a way working, and if you change something, people will say, I don't want to change. So I think with communication, also making very small steps, I think we can make it a reality. But it's going to take a while, and it's going to be a challenge.
Yeah, absolutely. And I think we're coming through with this as well at the conference. So there we have it. Essentially, our work package 8 from a shared value analysis has actually pinpointed, I think we'd all agree, what that shared value should be. What's the win-win that every single stakeholder can build consensus in a structured way to get behind, in order to make sure that we have a system that's fit for purpose, but not one that reinvents the wheel, because that's just never going to happen. And does it need to happen? No, it doesn't. But the work that we've done, building on some of the great investigatory work packages from IMI SOPHIA, to make that bridge from here are the research findings into reality, that's what we've been getting up to collectively for the last 5 years. And let's hope that the next 5 years will be actually making this a reality. So thank you both for taking the time out during ECHO or ECO.
I especially thank you, Jacqueline, of course, for leading the work package so brilliantly, because it's been a success because of you.
Well, I think collectively because of all of us. So thank you, and over to you.
Bye.
Bye.